And we are one of the sponsors of Building Hope for the Future, and we're so glad that each and every one of you are taking your time to come out tonight. I got to tell you that Anna and I have done a presentation at Will County Bar Association. We've done podcasts together. She handles our insurance at the office, and she is our referral and go-to person for our clients at Sterk Family Law, because a lot of us are in need and life is changing, and we need to have our medical insurance covered, and we need to know the risks and the shortfalls that we can all get into. And it's a very serious thing because you can really mess it up. You know what? Anna taught me something, and I'm going to share it with you before we ever get started. So, Mom, 90 years old, has heart palpitations, and again, we're back to the emergency room after 24 hours of urging her to go and finally getting her to move. When we get there, here's my first concern, because I know Anna. Is she going to be in for observation? Is she going to be there for a 72-hour hold? Are you sure Medicare is going to cover? Have you talked to the doctor about Medicare covering? Because if you don't talk to the doctor about Medicare covering, you might get a bill and it's not going to be covered. So Anna preaches this to me. So I feel like I am the new Medicare expert because I have to deal with Mom. So here I am at the doctor. I'm texting the doctor. Are we going to okay? Should we go to your office first? Maybe we should go from your office and have you admitted to the emergency room. Should we go directly to the emergency room? What should we do? And the doctor's like, hold on, I read the regulations again. Because he's like serious, because I think he's scared because I'm asking, what regulation are we going to be under this time? And I'm telling all of you, this is serious stuff. It sounds crazy, but it's so true. So Mom only had to spend one night, but we got it covered. Can you believe it? Because we coded it correctly, and guess what? Her troponin levels were up 2 points, praise the Lord, because we were able to get an admit without having a 3-day hold. Do you see what I'm saying? So I'm telling all of you, these are the crazy things you have to learn when you get to be 65 and older, and you also have to know it if you're caring for a parent. And you have to know also, and Anna, please, please, please cover the pitfalls of when you combine Medicare and your supplement and your prescription, and give the warning about underwriting, because Anna knows this stuff. So we're excited to have her tonight. I'm excited that you're here. More people will be dribbling in, I'm sure, and that's okay because we kind of run a casual atmosphere. There's plenty of food, more pizza to come. If you don't see pizza up here, just tell somebody there's plenty of pizza, plenty of pop. Help yourself, do whatever you need to do, order what you need to do, and we're going to learn so much tonight. So thank you so much for coming. We have sponsors. We're going to talk about that at the end of the program. We have a gift basket. We have 2 of them. So we're going to talk about that. We're going to do all that at the end of the program, and we're going to get into the real meaty stuff. But before I sit down, I recently was hospitalized, and I'll go into it in January, with a victory over what I faced, but we're all going for cancer support come January. Because guess what? Not only do all of us have to deal with Medicare, whether we're on Medicare ourselves or whether or not we have a family member on Medicare, but guess what? We all have to face that C word too, either through ourselves, our families, or our acquaintances. So we're going to address that come January. We're going to take December off and enjoy the holidays. So we'll be back with you. And Anna, thank you for coming out. We look forward to learning a lot.
Can you hear me? Hi everyone, I'm Anna Minkina, and hopefully I can teach you some things about Medicare. We go over individual insurance and small groups, but the main focus will be Medicare. So what I'm going to do is go through Medicare, who's eligible for Medicare, what are the ABCs and the coverage options. You hear A, B, C, D, F, G. So I'm going to go through that. What are the changes for 2020? I'm also going to go through the individual health insurance options, because sometimes you have a spouse or someone else that you know that is not 80 to 65. So one's turning 65 and the other one isn't. So what are we going to do about that person? New options for small group health insurance. If there's anybody who is self-employed, who has 1099, 2020 they're offering plans now, group plans for people who are 1099, which is really a new thing for everybody who's self-employed, because we had no options before. And what can I do to supplement the high deductible? What are my next steps? Medicare. Who's eligible for Medicare? It's a U.S. citizen or legal resident for at least 5 consecutive years. You have to be 65 or older, and otherwise you're younger than 65 and you have disabilities. We hear about some people who have disabilities and they're on Medicare. is end-stage renal disease. Those qualify as chronic. This is what I think happens when you go onto Medicare. You get inundated with all this advertising. People are sending, all the insurance companies are sending you information. You're getting phone calls, and everybody's telling you, oh, this is the best plan, or I have this plan, you should have this plan, or my sister has this plan, my brother, my cousin, somebody, my neighbor has this plan. So you're so confused because you're getting all this information. So it's like a maze that you're going through. So coverage options, A, B, C, D, med subs, what are all these? So Medicare, A and B, those come from Medicare directly. So A is your hospital, and B is your office visits, durable equipment. Once we move over. Let me try this. Part D is your prescription drug coverage. When can you enroll? 3 months prior to turning 65, the month you turn 65, 3 months afterward. And I'm just taking account someone who's turned 65. There's all sorts of rules and regulations if you're still working, whether you should take A and B, whether you should take B. So there's each person individually has to talk to someone to see what's best for them. A and B, so what's not covered? The Part A and B deductibles aren't covered for them. Co-insurance, the premiums, prescription drugs, hearing, vision, dental, long-term care and nursing home. People think that Medicare covers long-term care and nursing home. They do not. So they get scared when they see these bills of $7,000 a month, $8,000 a month. Medicare doesn't cover that, so you have to be prepared for that. Okay. Now we'll go into supplements. So when you get Medicare, you get A and B. Like I said, that covers 80% of your cost. So you need something to cover the additional 20% of your cost. That could be Medicare supplement or Advantage plan. And again, each person individually is different. I like to give the example of supplements, or you go to a doctor that accepts Medicare, and any doctor that accepts Medicare accepts a supplement. Advantage plans are good too, but it's per person, and they're more private insurance companies, and they're network-based. So as long as you stay in that network, then you're okay, but you can't go outside of the network. They've increased them. They used to be only HMOs, now they're HMO PPOs. But again, each person individually, you have to look at their needs to see, because if they're going to a certain doctor, we have to look at if that doctor accepts that plan. How much will they cover in the prescription drug coverage? So there's a lot of variables to make the decision between the supplement or an Advantage plan. I'm going to go through this part and then go more into Medicare. Medicare costs are going up. So 2019, the deductible for Part A was $1,364. In 2020, it's going up to $1,420. That's a big jump. Now the Part B deductible, 2019 was $185. 2020, it's going up to $198.
Is that annual?
No, those are, well, yeah, the annual. The Part B deductible is annually.
And the Part A is annual too?
That's annual.
Okay.
And then the Part B premium, now the Part B premium is based on income. So a lot of people are less than $85,000, it's $135.50. For 2019, 2020, it's going to go up to like $144.30. But again, the Part B premium is based on your income. And so when you go to the Social Security office, they will tell you what your premium will be for Part B. The Part D as a dog, is the prescription drug plan. This is where I get a lot of people telling me, I don't take any medication. Why do I have to have a prescription drug plan? That's because on your current insurance, the drug plan is right in there with your health insurance. It's just completely in there. But when you go on Medicare, it's a different animal. So when you go on Medicare, your Part D is the prescription drug, and you have to have that separately. Even if you don't take medication,
you have to have a Part D, otherwise penalty for the rest of your life. So you have to think of it this way, right now you have it, and you have insurance because in case something would happen. So that's why you want your prescription drug coverage. Even if you're not taking medication now, what if you have an accident or something, God forbid something else happens, you're gonna need prescription drug coverage. So that's why they want you to have it from the very beginning when you qualify for it. The good part is, I don't know if you've heard of the donut hole. The donut hole is where you have to pay more for your medication. Well, they're trying to close the donut hole. So in 2019, you will be paying 37% of the drug coverage during the gap. Sorry. There we go. Thank you.
I have a question while we're waiting.
Go ahead.
Sorry to ask a question.
No, that's
Can
good.
you explain why you're saying that it's going to cost more money for certain people depending on their income level, but these people don't get it?
So Medicare.
General rule, not even necessarily, just explain.
So Medicare Part B is based on your income, on your income you made, and that's how you pay. A lot of people think Medicare is free. Medicare is not free. You paid into it, and again, when you turn 65, you have to pay for that Part B, which is the hospital. With the office visits and that. A is hospitals, and it's doctor visits. So if you made more than $85,000, then your Part B deductible goes up according to that. So you could be, one person could be paying 144 and another person makes over 100,000, so they're paying 187 for that Part B premium.
Can you please address the fact that you're jointly filing with a spouse that might be younger?
Filing, you mean as far as?
Jointly, because you're going to pay more because you have a younger spouse.
Yes, you are going to pay more if you have a younger spouse in that too. So it depends on how you're filing jointly, and if you have a younger spouse. And then you have to remember too, that if you have a younger spouse, you're turning 65 and you have the younger spouse that's going to continue working in that. So you've got that income. And that younger spouse has to be on an individual plan. So there's a lot of variables on that. Because, for instance, I'll give you an instance. I have a client of mine and they work for a company and they turn 65. And so they want to go on to a supplement plan, Medicare supplement, because with the Medicare supplement plan, it was less expensive for them. But then their spouse could not be covered on the company plan because they jumped off and did a Medicare supplement. So there's so many variables you have to look at when you're looking at costing on what plan should I go on, supplement or advantage. And here's a really big key to supplements. Everybody says to me, I want the best supplement there is. When it comes to Medicare, you have to think of it as differently than individual insurance. It's its own little bubble. Medicare supplements, they're exactly the same benefits for every company. The only difference is price. Exactly the same benefits. So if they offer, the hospitalization, the doctor visits, the ambulatory, exactly the same benefits. So if you have it's called Plan F. You have Plan F with Blue Cross, you have Plan F with Mutual of Omaha, you have Plan F with United Healthcare. You have exactly the same benefits, the only difference is cost. So it's really hard, I know, for a lot of people to think about that because they're like, and Blue Cross is a phenomenal company, but they said, I've been with Blue Cross and I know that they're the best company. But when it comes to Medicare, you're all great because they're regulated by Medicare. So it's a completely different animal.
I'm still working, and at 65 I got my Medicare course at 65, but I didn't do anything about the BCD because I'm still working. Should I have done something?
No, because you're still working and you have insurance through your company.
Yes.
See, it's a different situation, so you're right. Because if you get group insurance through your company, then you have a credible plan. So you have hospital, right? You have doctor, you have prescription drug coverage. Yes.
But when I do retire, will I be penalized when I go over to
No.
BCD? Okay.
But you're going to have to give them a letter, it's called a letter of credible coverage, showing that the reason that you're coming off of that plan is because you're retiring and you've had coverage up to that point. And they verify it too to make sure that you've had it, otherwise you'll get that penalty for not having prescription drug coverage. So There's a lot of variables. And then when you do retire, you only have like 60 days to jump on. It's not like you have a ton of time. You only have like 60 days to make some changes and to jump on, so you have open enrollment.
And you say that the Medicare is as comparable to any other insurances. So if you choose BCD of Medicare, it's still just as good as Blue Cross or Anthem or any of the other.
Right. Right.
Anna, can you repeat the question when they asked it, because we can't hear the question?
Oh, I'm sorry. She was saying that when she retires from her work and jumps on, will she get a penalty at all? And no, if you're working and you show them a letter of credible coverage, then she can jump on and there's no penalty. Okay.
Can it only be at the time of open enrollment, or is there like a caveat being life's changed, that you retired? So there is a caveat that it doesn't.
It's 60 days of those time. Well, open enrollment, so when you first turn, you're gonna turn 65. Remember I said it's 3 months before the month of your birthday and 3 months after. That's called open enrollment. And then when you're retiring or something or making a change, that's another 60 days special enrollment. And here's another thing, that when you first turn 65, all the insurance companies will take you. No questions asked as far as how. All of them will take you. And you're okay when you retire too, because you're in that little window, you're just special enrollment. But after age 65, if you want to switch supplements or plans, then you go through underwriting. A lot of people do that, want to do it because of cost.
And if you go through underwriting, you're gonna say your costs are gonna be higher, right?
It's going to be higher because when you went in at 65, you went in one cost. So now you're 69 or 70 and you want to switch plans. So instead of starting off low, you're starting off high. So there really isn't much of a savings. And they all go pretty much the same. But the difference is when you first initially go in. The other thing with supplements is some companies offer discounts. So if you and your spouse are in the same company plan, the discounts for both of you are, depends on the company, 5%, 7%, which is a nice discount. So that's a really good thing too.
When you said switching plans, do you mean like switching to another insurance carrier, or switching?
Yeah.
Like
So-
if you were on plan N and you want to go F or G,
You do, you have that too.
you still have to go through underwriting for that? What's your question?
She said you have to go through underwriting if you switch plans, like you're on N and you want to go to F or G. After 65, yes, you have to
And
go
you're
through
still
underwriting.
with the same insurance company?
Yes,
But they deny you? Or
They can't deny you.
Check your premium. They can't deny you.
they can't deny you if you want to switch.
They can?
Yes. Medicare is a completely different animal. It's a completely different world. It's just like Medicare, people don't realize, Medicare is kind of like a nationwide PPO, I'd say, because any doctor that accepts Medicare accepts supplements. So it's like, anywhere you go that accepts Medicare will take the plan.
I got another question.
Sure.
If they deny you, can you then still stay on the plan you were?
Yes. Yes, you can stay in that plan because they're really, if you're switching plans and stuff, they'll just say that, no, we're not going to allow you to do it because of underwriting. You can stay in your plan that you're in, but we're not going to let you switch. Plans, here's another little thing. Oh, let me go back. It's on the bottom though, but I don't know if you've heard, but in 2020, they're going to get rid of Plan F. F as in Frank. It used to be like the Cadillac plan or Mercedes plan. If someone has Plan F, they can keep it. But anybody who's eligible after January 1st, 2020 can no longer get Plan F. And that's not an issue. There shouldn't be a problem. And the reason they're getting rid of Plan F is because the government came together about 3 or 4 years ago and thought that Plan F, which includes that deductible, you know, the $185 or $198 once a year, it includes that. So they felt that people were putting a burden on the health system because they had like a hangnail or a bump and they go to the doctor. So they thought, well, if we make them pay the deductible, then they'll think twice about going to the doctor for something minor. So that's why they're eliminating Plan F. So Plan F, high deductible Plan F, and Plan C after January 1st, 2020. if you turn 65 before and you retire, you're still eligible for it, but it's gonna be at a premium. So there are other plans out there that are comparable and less expensive.
So doctors can refuse a Medicare plan?
No,
Oh, they cannot? So
No.
all doctors have to take you?
Medicare supplements, Advantage plans are different. So Advantage plans are network-based. Medicare supplements are any doctor who accepts Medicare. So Advantage plans are less expensive. We think of them as like Medicare supplements, either pay now or pay later. The Advantage plans are like co-pays, when you go to the hospital, or when you go to the doctor, there's a lot of co-pays involved. But sometimes they're like zero deductibles, $85, they're less expensive. But you have to be able to stay in that network and have to be able to pay like $3,500 or $3,600 for the year. So that's why we say pay now, pay later. Go ahead.
Any referrals for an Advantage plan?
Depends. There's HMOs and there's PPOs. So the HMOs you need referrals, the PPOs you don't, but you have to, with both plans, you have to stay network. They will not allow out of network. And then, let's say you're out of state. The line that they use is life-threatening or loss of limb. You can't go into a doctor with a cold. If it's an emergency, they'll take care of you anyway. But if it's, I got a cold, I cut my finger, I do something like that, you're out of network and you're responsible for the whole cost. A really important thing, Gwen mentioned before, I've worked with a lot of Medicare people, clients and that, and I've learned through the years, and so I try to pass it on. So Gwen mentioned about the observation. I had a client and his wife fell at work and brought her in the hospital. They wanted to do 24-hour observation. And he said, she's fine. He's like, no, we want her here for 24-hour observation. So I said, all right. She stayed, he went and picked her up in the morning, but he only picked her up 22 hours, not 24 hours. So he was responsible for the whole bill because Medicare said that he didn't follow the rules of the doctor and took her out early and they didn't want to pay and neither did the supplement. So if Medicare doesn't pay, the supplement doesn't pay. We'll never have it say that the supplement will pay. If Medicare doesn't pay, supplement doesn't pay. So when they say 24 hours, that's what I never talking about, you stay 24 hours. That's an important one.
And if you decide to sign out, I'm in healthcare, and AMA, we have a lot of seniors who decide they just don't want to be there, and they leave. The Medicare does.
Medicare won't pay them because they're not following doctor's orders. So they look at it that way. And then the other thing is the three-day rule, which is really interesting. So to qualify for rehab, you have to be in the hospital 3 nights on that. I had a aunt of mine, she was handicapped, she fell, she broke her arm, she could barely walk, and that they only kept her 24 hours. Even though she was complaining about other issues, 24 hours they got her out of there. So she did not qualify for rehab, and she could not take care of herself. So we had to use up her savings at $7,000 a month to put her in a rehab place because she couldn't take care of herself. Okay.
We had a similar situation to that and found out if you go to the hospital and you get the liaison between the Medicare, that sometimes something can be done. I mean, you just don't let them throw you out.
It's hard though because each hospital is different and it depends on who you get. It's kind of like the Social Security office. I tell people to go to the Social Security office and they'll go there, you know, for their A&B or ask about their Social Security. And they'll come back and like, no, wrong answer, go back. And they'll talk to somebody else and they'll get a completely different answer, which is sad.
Can you talk a little bit about the tiers for drugs on your prescription plan?
Yes.
Different drugs are different tiers depending on the plan.
Right. So there are different tiers on the drugs. 1, 2, 3, 4, and 5. 1 and 2 are usually like the generic or brand name generic drugs. 3, 4, and 5, then you start getting into the cancer drugs, more expensive drugs. And so depending on, when you get to the Medicare, the Part D plans, That's why they separated them out, because this time of year, right now, is open enrollment for Medicare. And say last year you were on one drug, but this year you had cancer. Now you're in a higher tier of drugs. So what we do is we put all the drugs in the system, and then we see who pays the most for that different drug. So when it comes to the drug plans, they all pay differently on it. They
Yeah, well,
totally.
granted, you don't get cancer in February, you gotta get cancer in November.
Right. No, you're absolutely right. You have to get it somewhere between October 15th and December 7th. Sorry. And there's a plan, there's a discount program that I tell everyone about. It doesn't matter if you're on insurance, what. It's called GoodRx.com. GoodRx.com. It's a free site. It's got an app on your iPhone. I can tell you personally, I have insurance, and in February I had the flu, so I had to have Tamiflu and some other antibiotic. So I went to Walmart and I pulled up and they said something ridiculous, like almost $300. So I said to them, tell me what that drug is. So she told me what the drugs were, and I looked it up on my GoodRx app, and there's a coupon that pops up. So I gave her my coupon, so instead of $300, it was $52. Big difference. And then you don't have to do a thing. It's not like you have to redeem a coupon, you don't have to do anything. You show them your phone, because it's right on the phone, they scan it, and there's your savings. I can't tell you how many times I've used it. I spoke to a senior today, he's in Indiana, and he told me that he saves hundreds of dollars by using GoodRx.com. It's not like you can't use it in conjunction with your insurance, it's either or. But 9 times out of 10, GoodRx is cheaper.
What happens with readmissions?
Pardon me?
What happens with readmissions? Say, Aunt Mabel, you took Aunt Mabel home, you got her home, she was dehydrated, became septic, that's her back again. What happens with Medicare readmissions?
That one I'm not real familiar with, because they have so many rules with the readmission and they have different parameters, so I'm not real familiar with all those rules. And unfortunately, they're changing those regularly as far as when they can readmit, how long they can stay away, and then how much they'll pay, so.
Can I make a comment? I think that it's important that you go to a physician who knows the rules, or
Right.
at least as a reference source, and I would recommend to everybody to get a doctor who is going to Medicare seminars regularly and do regulations, and if they don't, find out a networking pharmacy in your area that knows them. Because if you get real, your mom was in rehab, you would call, because you don't go to the hospital unless you're sure you're going to 3 days stay or you're out, it's serious stuff.
It is, it's serious. That's what said. It's really, really important. And one little mistake from a doctor, I had a client of mine call me, and in fact, he's still working at a company, and his HR department called me, and he said, he just got a bill for $19,000. I'm like, well, how can that happen? He's on Medicare and he's got a supplement. He goes, no, they said pay this right away. And so he sent me a copy of it. Well, they had billed the wrong insurance company. He used to be on United Healthcare, but he was no longer on United Healthcare. Now he was on a Medicare supplement. But if you don't check that or look at it, then you just have a complete heart attack. I'm like, $19,000? I thought this was supposed to be covered. So one little error, as well as saying, one procedure code that's wrong. So you just have to make sure that you're aware of all of it and question everything. I tell everybody, don't pay the bill without questioning it. Question?
I signed up for Medicare Part A when I turned 65.
Right.
Because we called his insurance company, he's still covered, and I'm still covered under his insurance.
Right.
So when he retires, then the letter.
Credible coverage.
Now, and I don't have to be underwritten for that, right?
No, because you're in a special enrollment. Yeah. I know there's so many variables in that. That's why we always say to talk to somebody who understands it, because for us it's kind of like a puzzle. It's not the same for, you have your situation, somebody else has something completely different. So that's why I say to everybody, just sit down with someone who understands it and find out what your needs are and find a plan that meets your needs, not someone else's on that. Okay.
What replaces Plan F?
There's Plan G. G is in George.
Repeat the question.
What replaces Plan F? and there's Plan G. And the only difference between Plan F and G is that once a year deductible. That's it. The benefits are exactly the same. And believe it or not, Plan G was cheaper premium per month. I have a tendency to put my clients on G because I'm going to give you one instance. I just put one of my clients on Plan G last week, and the difference per month between Plan F and Plan G was probably around $30 a month. So
That's
we,
more than the deductible.
pardon me?
That's more than the deductible. Right.
So yes, so it was $30, you're absolutely right. So I did 30 times 12, and then I took off the deductible, so you're absolutely right. And then I still had money he could use for his drug plan. So the savings was incredible. But a lot of people, I know there's a lot of them out there that will just say, just go on this plan, we won't explain the differences. But they're, don't be afraid if somebody comes up and gives you a different plan like G and that, like we said, they're exactly the same plan. I know when you turn 65, like I said, right now, I've had so many people tell me, oh my God, I'm watching television. That's the worst one. I have my clients call me like, why don't I have that plan? It says $0, zero deductible, and I get my hearing and my vision, and I'm like, you have to make sure you know what free means, be careful what you wish for. So that's why I said the advertising kind of confuses everyone on something like that.
Since you're talking about the advertising, can you do the Medicare.com, Medicare.gov?
Thank you, Lynn. That's the other thing. So the only place, if you were looking for information, the only place you should go is Medicare.gov. Medicare.gov, not Medicare.com. Medicare.com is a sales site. It's not a government site. And plus Medicare.com is sending you information in the mail, so people think it's Medicare. It's not Medicare, it's a sales site. So again, just like for the individuals under 65, it's healthcare.gov, not healthcare.com. Because if you go to healthcare.com, that's a sales site. So just little words, gov versus com, will do the difference on it. And then there's other companies out there, and there's nothing wrong with them, but it just confuses people. There's one that's called USA Health, so they think that it's a government plan. Again, a sales company, it's called USA Health. Just little things to be aware of. Any other questions on Medicare? Go ahead.
How about a transition, if you're on a COBRA plan presently, and with medical diagnosis transition to Medicare?
You're okay. So if you're on COBRA, and then you're aging in to the 65, is that what you're saying?
No, it's secondary to discounting.
Are you on Medicare though?
Not yet, I'm on
Okay.
COBRA.
You're on COBRA. When you go to Medicare, there's no underwriting. Because when you go you get that open enrollment, so there's no underwriting.
Come closer. 2 more steps so they can see you.
I'm sorry. Any other questions? Go ahead.
All right, I was on COBRA, now I'm on this marketplace. Outrageous.
Are you on Marketplace under 65?
I'm still under 65, so I'm gonna be 65 next year.
Okay.
I'm still good.
Yeah. You can stay on the Marketplace, and then when you turn 65, you would transition over to Medicare and your Medicare supplement. And the prices, yes, it's really not the affordable, it's the unaffordable care.
$900 a month.
$900 a month, that's exactly right.
That's the cheapest.
That's it. So there's a big difference. I could give you an example too, because a lot of people say, how much is it going to cost me when I get to Medicare? So let's just say, Lynn, you'd be a good example. Lynn, how much were you paying a month? How much were you paying a month for your health insurance?
$1,000 a month.
$1,000 a month.
And I have no health problems, I'm just fat.
$1,000 a month. And what was your deductible?
Sure.
What was your deductible?
4,500
done. Trust me, I'd have had a heart attack if I'd have known. I got a $4,000 bill, so I just waited for the insurance to pay.
Yeah, right.
And after 3 months, I called them up and said, like, when are you gonna pay? They said, oh, no, your deductible's $4,500, you haven't met it.
Yes.
I said to the doctor, unless I'm dying, we do no more tests until I'm dead. That's it.
You betcha.
So she paid $1,000 for an under 65, then you turn 65, and let's just say you made under 85,000, so you're paying your part, the premium per month, you're paying $144.50. $144, it's called $144. And you're paying that to Medicare. And then you're paying a supplement for a woman, I'll say you're paying let's say 15. So that's what? 115, 144, 255? 255?
For me now?
Yeah, 255, and then you have a drug plan, let's say it's another 30. So it's about 285.
I pay nothing now compared to what I was paying.
Right, so it's probably about $300. For a normal person, you go from like $1,000 to $300. So it's a big, big savings. And then when on the under 65, you have to stay in network. You know, it depends on what plan you're on. You gotta stay in network. When you go on Medicare, again, any doctor, if you're on a supplement, any doctor that accepts Medicare accepts your supplement.
I have a question. So you've got your supplement plan, but it goes up every year. So Fred, for example, 70, and his went up to 209 for the supplement. So let's not all be fooled. You
Right.
said 115 for her supplement, but she's young. When she's turned 70,
Still fat, but young.
Medicare costs are going up. So you went from 135 to 144, right?
Right, right.
Now you went from 185 to 198.
Right.
Well, you started out at 65, I think his premium was 159, now this year at 70, it'll be 209, it went up $50 a month. So I just don't want people to think that it's gonna be free.
No, it's not free, absolutely.
Aging in.
We're all aging in,
That's
it's 10,000 people a day, right?
So there's
Right.
something that's all in that.
Right?
No, but I can tell you different. For instance, I have a woman, I do special groups too, and I have a woman who priced out on a group versus one. Only just to give you the example. On a group plan, or on the individual plan on a HMO for 2022, we'd be paying $1,033. On the group of one, she's paying $720. So it's $300 a month saving. I know the Medicare supplements are going to go up, but I think the healthcare under 65 is going up a lot faster. Pardon me? I can go through that afterward. If we do Medicare.
I have one more question on
Sure.
Medicare, just so that we're all clear. So you go out and buy combined plans, you turn 65, or you start collecting Medicare. You're gonna pay Part B out of your Medicare plan. You're gonna get your supplement, but if you get a combined supplement with your prescription plan, and then all of a sudden you decide you have cancer or an autoimmune and you've got drug plans, you need to have a combined drug plan. You're gonna go to underwriting, correct, for your supplement, and you're gonna break apart your supplement, your prescription plan, isn't it?
No. So supplements are always separate, and so are drug plans. And supplements, you really don't need to change them. The only thing that will change is cost of it. So if you're on a supplement, remember, you won't need to change it. But your drug plan, you're right. So drug plan, you change once a year during this open enrollment, October 15th to December 7th. That's when you change your drug plan, or if you're on an Advantage plan and you want to change an Advantage plan. But if you have, like I said, if you're on a supplement, there's really no reason to change because you're not going to get more benefits jumping from one company to another. They're exactly the same benefits.
But what if you take a supplemental form of an HMO and now you want to have HMO coverage?
No, those aren't HMOs. So supplements are all the same. Advantage plans are HMO or PPO.
So say you want to go from an Advantage plan to a straight supplement, so let's get the lingo.
Okay, so you go to an Advantage plan to a straight supplement, you can be subject to underwriting.
Correct. And what's the difference in price between being on an Advantage plan when you turn 65 and the reality is you're sick now and when you want to go to Florida, you want to do other things, you're at age 70, you're going to underwriting, are you going to pay more?
You're gonna, well, yeah, you're gonna pay, right, you're gonna pay the price at age 70. You're absolutely right. It's not, they don't price it up based on medical, they just yay or nay. They basically say they deny you or they don't. But you're absolutely right. If you go with the Advantage plan, unless you're in good health, you can go from Advantage to a supplement if you're in good health, but if you're not. And they do allow you though, within the first year to switch back and forth. And then there are within the first year, if you're on an Advantage plan, you can switch back to a supplement with no questions asked. And then there's little loopholes, believe it or not, in Advantage plans. Really small ones, like depending on if you're at a nursing home for something special for like 90 days, they give you like this small window of 30 days to switch over with no penalty and no underwriting. So it's really, and they change the rules daily, so.
And is it a risk then to go on an Advantage plan?
The only thing, the risk is that when you're in an Advantage plan, you have to stay in the network. So I had one gentleman say to me, my wife is, he lived in Joliet, but the only people that would take him, his wife, on the Advantage plan was way out by Palos Hills. So he had to drive from Joliet to Palos Hills because that was the only place that he could find that would take his wife on the Advantage plan he chose on. So it's a little bit riskier as far as doctors and that. If your doctors are all on the network, it's a good plan, but if you want a choice, freedom of choice, supplements are any doctor who takes Medicare. It's you know, whether you want to be on the network, and it's also affordability.
I have what I believe is probably a naive question, but in regards to supplemental insurance, for your medical, so supplemental doesn't cover anything on drugs then? It's just for medical care?
Medical. Part D is drugs, supplement is medical. That's like a lot of people get confused. So Medicare is health insurance. Social Security is completely different. So you could be on Medicare without taking your Social Security. So Medicare insurance, Social Security, completely different. I can tell you a little, I do some sessions too with a couple other people about Social Security and Medicare, and just a really little tidbit. I don't know if you people understand it, but when we were growing up, like my parents, they turned 65, you took your Social Security. Now it's not that way anymore. And I learned something all the time from my financial person who does the information about Social Security. So depending on what year you were born, that's when you should take, you get 100% of your Social Security. So like for instance, 1954, people who turned 65 this year, they get 100% of their Social Security at age 66. But here's something that Social Security won't tell you. So if you turn 66 in April of next year, so you turn 66, you go to the Social Security office and they'll say, well, do you want to take your Social Security in April or May? I'll take it in April. Not the right answer, and they're not going to tell you this, because if you take it in April, Medicare starts on the first day of the month of your birthday. So if you took it on April 1st and your birthday is April 25th, you're still considered 65. So if you're taking your Social Security at your full retirement age, you do it the month after you turn 66. So 66 in 7 months, you do it 66 in 8 months. So it's the month after. And Social Security didn't tell my client this at all. So he turned 66. He turned 66 in August, and he went in and said, oh, I'll take it August 1st. So they, luckily, his wife and I worked together, and she made him go in there and say, no, stop it. Start it on September 1st. But Social Security is not going to advise you on that, because that's a financial thing. All they're going to do is, do you want it now or do you want it next month? So there's a lot of interesting things. It's really changed as far as Social Security and Medicare for all of us. Any other questions? All right, I'm going to go through a couple other things individual-wise too. Individual is under 65. Again, the deductibles are going up, maximum out-of-pockets are going up. There's all sorts of plans, and it's so confusing. There's individual plans, there's marketplace plans, there's short-term plans. And a lot of people say, I don't want to be in Obamacare. I don't think they realize that everything is really Obamacare. It's an Obamacare, and there's the marketplace. So the marketplace plans and the individual plans that they offer are exactly the same. The only difference is you're going to be in the marketplace if you qualify for a subsidy based on your income. Because I had a lot of people saying, I went to the marketplace, you qualify for subsidy? No, then you shouldn't be on the marketplace. Because if you go on the marketplace, it says, do you allow us to look at your financials for the next 5 years? So that's part of it. So they're exactly the same, but the difference is, one where you qualify for a subsidy, that's the only place you can get a subsidy, and that's healthcare.gov, G-O-V, not com, healthcare.gov. It's an interesting area. Lauren, I found something interesting out today. We were going on one of the sites, the Blue Cross sites, and they had 2 plans, 2 silver, I don't think it was an HMO, PPOs. They're limited PPOs though. So on the individual market, you don't have access to those nationwide PPOs anymore. But it was a limited PPO, and it was a silver one, and they had 2 of them, and Lauren and I kept looking at them, and it was exactly the same thing. The deductible was the same, out of pocket was the same. The only difference was one was called 203, the other one was 303, and one was cheaper than the other. So we could not find out the difference. So I called Blue Cross and I'm like, what is the difference? And the woman said to me, the only difference is one is offered on the marketplace, both on the marketplace and regular, and the other one is only offered on the retail market, not the marketplace. Well, the one that was more expensive was the one that was offered on the marketplace because the price was more, and then they would add the subsidy to it. I'm like, so you're marking it up and then putting the subsidy on there, which didn't make any sense to me, but it was a significant difference. I think it was $100 difference, wasn't it?
Like $100 difference, yeah.
But still, it was like, wait, so this plan is marked up, and then you're giving us a subsidy. It didn't make any sense.
If you do go a subsidy, because if you're not collecting, what kind of information can you give them monthly, information on, like, your financial or whatever?
You do. If you qualify for subsidy.
Repeat the question.
She said, what information do you need if you were applying on healthcare.gov for a subsidy? And you have to give financial, you have to agree to give financial information, and then you have to show them where you're getting your income every month. And sometimes they'll ask for like a paycheck stub or some other stuff of information just to see where you're getting your income. And then they will verify that against your taxes every year. So if you're off, then they will reconcile. When you do your taxes at the end of the year, they'll reconcile.
Do it penalize you? Is it in addition, like say, you got a job midstream and then you now don't qualify for a subsidy?
You do. If your income changes,
Penalize you?
they don't penalize you, but if your income changes, you should let them know right away, because otherwise, that way they can either lessen the subsidy or the other way, do it if you don't notify them. When you do your taxes, then you'll have to pay back all that money that they gave you. Pay now, pay later. Pay now, pay later. I'm not.
That's better.
Any other questions?
Like those medical care plans, like come through some place like Moody Bible Institute, and you pay into something like that. Are the benefits? I hear about it. It's like they give you these examples of people who had catastrophic events and how everybody took part of it and their payments were less. No.
Repeat.
I am not an advocate. She's asking about the Christian Share program. Christian Share non-insurance program. They're not. In fact, I did a presentation and they were there, and I specifically said to them, you cannot say you're insurance because you're not. So they are not insurance. And so what they do is, you have to, when you fill out the application, you have to state, you know, you're a Christian and that, so you have to put that in there. And then it's an open, like a fixed benefit plan. So you go to the doctor, they give you so much, you go to the hospital, they give you so much. But the thing I like about it is there's a cap, usually like $125,000. So let's say you're a member for 20 years and she's a member for 5 years and you're a member for 2 years. And unfortunately, each of you got cancer. And so what happens is everybody has to kick in. But who's going to get the funds first? It would be the one with 20 years will probably get the funds first. But everybody has to chip in, pay for that additional $125,000. So I would want my help depending on everybody else chipping in. It's kind of like GoFundMe. And there's so many people using GoFundMe, and it's sad because the healthcare costs are so much right now. It's really important to make sure that you have all your papers in order, your healthcare costs, any kind of, like Gwen said, they're going to talk about cancer. There are plans out there. There's like an AFFECT plan with cancer. You need to make sure you're prepared because we never know. I have a very close friend of mine, and her friend, 48 I think, about 3 weeks ago, got a virus. They still haven't figured it out. Went to her brain. They had to transfer her to Northwestern. She kept having seizures. Then her organ shut down. 3 weeks, she was gone. They still don't know what the virus was, what it was that caused it. But you just don't know. You just want to prepare, especially for all those costs. It's really, really important thing. When people tell me that they don't want health insurance because they're healthy, I had a client of mine, and it was husband, wife, and 2 kids. And last year, and she was a financial person, and he was something, he made a lot of money too, an engineer, 2 kids, and they were 42. And she's like, I'm not paying these premiums. I'm just not spending the money to pay for these premiums. And then in March or April of this year, I got a call from a friend of theirs, and he's like, Kathy needs insurance. Well, if it's not open enrollment, did they get divorced? Did someone die? Did they move? Did they change their income? Nope. She got diagnosed with breast cancer, and nobody will treat her because she has no insurance. So what she was forced to do is go to Susan B. Komen, go to Strides, go to all these cancer associations to see how she can get treatment. But as I mentioned to everyone, when I do the speaking engagements, you're forced to have insurance on your car. You're forced to have insurance on your house. But when it comes to your own health, then people don't want to get insurance on their health. And if you don't have your health, then you won't have the car or the house or anything else. So it's really important.
But don't some, sorry.
Go ahead.
And don't some people have a concierge plan so they can't afford the insurance?
Concierge, not insurance. Concierge plan. I like concierge plans when you have a high deductible plan, which is really good. Concierge plans is you pay a doctor so much money for the whole year, and you have kind of almost like an unlimited access to them. And they have like lower costs for like blood workup and different things. They have access to that. So it's really good if you have a high deductible plan to do something like that. That's a good thing. But you always want to have health insurance. There's also short-term plans, which are good if you have like in between jobs and that. But the only problem with short-term plans is they do underwriting. So they don't cover any kind of pre-existing conditions. And the other thing is last year, you could have a short-term plan for 11 months, but in Illinois, they dropped it down to 6 months. So I don't feel comfortable putting on someone on a plan for 6 months. So like say they started in January of next year and it ended in June. But in between, let's say in May, now they had a cancer diagnosis. Now they can't get insurance because they're outside of open enrollment, and a short-term plan expiring is not a qualifying event. So that's why I don't feel comfortable. I had a young gentleman loses insurance, and unfortunately I said to him, do you have any pre-existing conditions? No, don't have anything. Don't smoke? No, don't have anything. So we filled out the application, And in the mail today, I got a letter that says, we denied coverage. That due to HIPAA, they couldn't tell me, so I had to call him and like, something in your records, but they denied you, so you are without insurance completely. Like wrap you in a bubble. It's like, don't go anywhere until you get insurance. He's lucky and he's in open enrollment, but it doesn't start till January.
So the thing I think I've learned most of all from everything so far is that whether it's insurance or whether it's Medicare, it really is all individual to that specific person. Would everybody just be smart, even though you're giving them general information, would they not be smart to schedule a private consultation to find out what's going on in their life so they get the best choices that are for
That's the
them?
best. So I represent all the companies, all of them. There's no charge for my services or no charge, additional charge of the plans. And I think a lot of people thought about, you know, the old times where it's like, I had someone say to me, she goes, I'll get your quote and then I'm gonna go somewhere else. Well, it's exactly the same price. So if I quote you Blue Cross and you call Blue Cross, it's exactly the same price in all the carriers. What they changed it around is now they give us their commission if we go directly. And then you have somebody to talk to instead of trying to dial 1-800, I can't get through. So you call myself instead of trying to get through to them. Unless it's claim, which is all HIPAA. But it's much, much easier to do it that way. And we do the shopping for you. Because like I said, if all the plans are, like the Medicare supplements, if they're all exactly alike, why wouldn't you go with a less expensive plan? You're getting the same thing. You're getting that Cadillac at a cost of a Volkswagen. Okay.
Did you say that if you have a pre-existing medical condition, I had leukemia, and I was treated with chemo and all works, and but I had the good PPO insurance, and I had to, some of my shots would cost as much as $5,000, you know, for each shot. But I had all this insurance, but now once I retire, having a pre-condition as leukemia, you immunocompromised. You kind of have that title on your medical history once you've had it. Will that, with that diagnosis, previous diagnosis, will I have any problems?
With Medicare? No, she said if she had a pre-existing condition, will that follow her and she won't be able to get any kind of like Medicare supplement? No. When you first turn 65 or when you're first eligible, like if you're leaving your job in 60 days or when you're first eligible, there's no questions asked. That's like the individual. So individual insurance too. Individual insurance now still, there's no questions asked, pre-existing or that. Short term, yes, it's a different animal. And the other thing is, I've had a lot of clients, I do small groups too. In small groups under 50, there are no questions, health questions either, which is a little thing out there too, which is really interesting.
And when you move from state to state and you've got a Medicare supplement, do you have to check to make sure that what you have is eligible in the state that you're going to and that your Medicare plan is eligible in the state that you're going to?
Medicare supplements, you can go state to state. It's going to change the cost on it, so depending on what state, now you have to let them know that you can carry your Medicare supplements.
What about the Medicare plan?
Not the Medicare Advantage plans. The Medicare Advantage plans are network-based and they're state-based. So if you have a Medicare Advantage here in Illinois and then you move to Connecticut, then you have to find a different plan.
I don't know what that's going to say.
So you can't move. That's it. Can't move. What else is going to tell you about moving? And prices vary by state. I'm glad you said that. So I have, in Illinois, remember I gave you that instance about, probably about $300 a month. So that same plan, I have a sister that lives in Florida. So when she turned 65, we're checking costs. So here in Illinois, it would have been about $125 just for the supplement. Same plan in Florida was over $300. Yeah, so each state, you know, even though the plans are the same, like the F, the G, and everything, but each state's costs are different. I have clients in Wisconsin, and those were different too. traveling within the U.S., if you're on a supplement, any doctor that takes Medicare. If you're traveling out of the country, I highly recommend everybody get travel insurance. Highly. I'll tell you a quick horror story. When I was years ago, I went with a group of insurance people, and we went to Mexico, and we were all of us were like body surfing. One of the agents jumped in and hit the sand. Didn't realize how shallow it was. He cracked his neck. Yes. And so went to the hospital in Mexico and basically said that he had to have surgery. Well, he didn't want surgery down there. So he had to be transported from Mexico to Chicago. He had one of those halos on, and he had to be in an air pressurized airplane. Well, your insurance doesn't cover that. So luckily, the owners of our company were with us because the plane would not take off unless they were paid. It cost them $24,000 to bring them from Mexico to Chicago straight to Northwestern. If you had travel insurance, it would have been maybe $150. So if you're traveling out of the country, I always highly recommend doing it because your insurance does not cover you coming back to the U.S. to where you were going. Go ahead.
Yeah, well, we always get travel insurance, but I know that some of the Medicare supplement plans,
But you have to pay for it up front. They have foreign travel, but then you have to pay for it and you get reimbursed, but it still doesn't cover you being airlifted
right,
back.
but we always get insurance.
Yeah, I highly recommend that.
And that's for all insurance, Medicare, and
Everything.
everything.
You're out of the country, every time I leave the country, I always get the travel insurance because I had that, in the back of my head, I have that gentleman who had to be airlifted back. 24,000 versus like 130 because the price is based on where you're going and your length of stay. I went out to, this is my daughter in Australia, and we were out there 3 weeks. It cost me like almost $300, but I had the feeling that if something happened, I knew I was getting back home.
We do get the travel insurance only because if something happens to our elderly parents.
Right.
But if you had an earache, does that travel insurance cover that?
It covers it going to the doctor though.
Repeat the question.
You said if you have an earache, does it cover it?
Yeah, if you've got a sore throat, you have to go to the doctor, you're out of the country.
You're out of the country, it'll
Will
cover
that
it.
travel insurance?
Travel insurance is covered.
Who do you get this travel insurance from?
I have it, I have a number of carriers, and they have different senior plans too. I know I'll finish. I'm just gonna finish up. This year, just real quick, they have new plans for people who are 1099, which is phenomenal. You can start a group with 2 1099 people. The advantages are you have access to nationwide networks. You can go to Northwestern and Rush. If you're on a regular insurance individual plan, non-group plan, you cannot go to Northwestern or Rush with the Blue Cross plans. They won't accept them. Remember, individual, not group plans, different animal, or unless you're on a grandfather Blue Cross plan. They're less expensive than individual plans, wider networks, and a lot more benefits. I had the instance, I told you before, a woman, exact same plan, she was on the HMO, $1,033 for next year, same exact plan, was about $720, so $300 saving, and a family. So a lot of us are 1099s, and especially real estate people. They are so excited because they were never able to access a group plan, so those are some additional benefits. So thank you. So here's a good way to save money. We can contain the health insurance cost if you're willing to let your coworkers diagnose you with information you find on the internet. I think that's a great solution. All right, so just a little bit of just make sure that you have everything in place. There's so many additional benefits out there that you should be aware of. You know, health insurance, dental, vision, life, accident, critical illness, and as Gwen said, you know, cancer is really prominent out there, so you want to make sure you have a plan. For those of you self-employed, if you don't work, then you don't get any money, so you want to make sure you look at all the benefits that are out
I
there.
have a question. What's Aflac used for?
Affleck is the duck. Affleck pays you money. So In fact, the person that we use for Affleck, Marty, a great example. She isn't here, she was gonna come attend. She was babysitting her friend's dog and walking it outside. She had sandals on. The dog got off the leash because it got spooked. She went running after the dog, tripped, fell, landed on her shoulder. And she had to have surgery on her shoulder because she tore it and broke some things. And so Affleck paid for her surgery, for the x-rays, for the emergency room, for her physical therapy, for modifications to her house because she could only use one arm, and it's paid to you. It's no coordination with insurance, it pays you directly. So she's getting money coming in, even though she can't work, she's getting money coming in so she can pay for her mortgage, she can pay for, you know, a car, whatever it is, which is really important.
So you don't need insurance to have
Connie?
When you're asking the Aflac, is that critical care? Is that?
There's a lot of different options with it. There's
Well,
like,
I just said when Aflac, I guess that in addition to your health insurance.
it's in addition to your health insurance, yes.
Well, and then with Affleck, they've got the accident.
They have the accident plan, we have the accident and the cancer plan, critical illness, heart, stroke. I think I have all of them. Every time I go and see a client, they have a disease, I call up Marty. Marty, do I have that plan? Oh, wait, one more, just the last one. Just remember, open enrollment, October 15th to December 7th is for Medicare Part D changes and Advantage plans. Open enrollment for 65 and under in small groups, November 1st to December 15th. It's really short, 45 days to make a decision, so it's really good to talk to somebody and make sure. And with the Part D plan, I highly recommend you talk to somebody every year because, like I said, it might be good this year, next year it's not. I have so many clients that talk to me because they were on a plan and all of a sudden the drug plan they went on jumped like double. So we put their drugs in and they found a different plan.
Our daughter is going to turn 26 in October. So would she still be eligible for the open enrollment?
I work on those too. I've just been working on those. So 26 special enrollment. So she can do it within 60 days of turning 26. She only has 60 days. Thank you, everyone. I appreciate your
One last
time.
question.
Go ahead.
30 seconds on Medicare for all. 30 seconds.
No comment. No, it's...
There's one more question.
Go ahead.
3 seconds.
Why can't I pick that up in the summer? Why does it only have to be this time of the year and every year?
It's Medicare. It's not ours. It's the federal government. I know.
Oh, they regulate that?
They regulate that. I would really like it if they weren't because for me, every year holidays, I only have October 15th, so I have 2 months to take care of everyone. Medicare, small groups and individuals. So 2 months we have to do it. And it's really not enough time. I'd love it to be like January, February, so it's past the holidays and the beginning of the new year. That would be ideal. Thank you.